Hi, everyone. So, right before I got up here, I did something to help calm my nerves down. In fact, I'm sure all of you here have done this or been told to do it before giving a big talk. I took a deep breath in and a deep breath out. Simple, right? But what if I wasn't able to breathe without coughing or having mucus stuck in my airway? That's the reality of children diagnosed with a rare lung condition called primary ciliary dyskinesia or PCD. PCD causes defects in cilia, which are tiny hair like structures that line many organs, including your respiratory tract. Think of them as your body's built in janitors. They sweep microbes and debris that you inhale out of your airways. But because they can't do their job, up to 80% of PCD patients have recurrent respiratory infections by the time they're in preschool. Frequent infections over time can lead to irreversible lung damage, especially if not monitored closely. What's worse, there's no cure for this disease. So, how does a clinician monitor lung health? They could use a spirometer, which quantifies your lung health into a numerical value. But the problem with this device and other measures is that it's not sensitive enough to pick up on early changes in the lung. And so science has turned to the use of medical imaging. An MRI scan can give us information on structure and function for many organs, and it works by imaging parts of the body where hydrogen is present in the form of water. But when it comes to the lungs, you'll find that it's filled with air, which means if you use a regular MRI to scan the lungs, they show up as black, as seen in the image on the left. It's kind of like trying to see in a really dark room. But this problem can be overcome by inhaling a contrast agent like xenon, a safe gas that allows us to visualize ventilation in real time. Think of it as shining a bright flashlight in your dark room. Suddenly, you can see, as seen in the image on the right. By using this method, we can quantify the poorly ventilated areas of the lung into a defect percent, which can be tracked over time and is highly sensitive to early changes in the lung. So let's say a patient's defect percent is 6% today and 10% a month from now. Is that a meaningful difference, or is that the normal range the percent fluctuates within? That is the essence of my research question. And to answer it, I will be scanning patients with PCD in the MRI twice a month apart to see how variable the defect percent is and how it compares to other established lung outcome measures. The goal of this research is to determine the normal range of variability so this tool can be validated and used clinically. Now, when a drug clinical trial begins or a novel intervention for PCD is introduced, we will be prepared to image the lung safely, track improvement over time, and do this by catching kids' breath using xenon MRI. Thank you.